Jason Lee from South Korea. Nice to meet you. So I am very happy to have a chance to give you a presentation on my study. I will announce the hype treatment experience of uterine fibroid and adenomyosis from February 2010 to January 2015. History of hypo and the principle of hype treatment is a kind of heat therapy. This JC model has been used in hype treatment, focused ultrasound inside of the rubber, and the other moving image is the real treatment image. Focused ultrasound destroyed inside of the intramural myoma. Effective for tumor cell. The first is direct thermal abrasion. The second is cavitation effect, destroying tumor cell by increasing cytoplasm temperature. The third is the damaging for tumor nursing blood capillary, coagulation necrosis. The demographic data of uterine fibroid and adenomyosis, average age is 40, average treatment time is 18 minutes. I have no patient with malignancy after hypo. I have no idea that hidden malignancy was completely removed, or fortunately no patient with malignancy was shown so far. All kinds of the non-surgical treatment for uterine fibroid, such as RF, uterine artery embolization, and the hypo, cannot completely rule out of the malignant tumor. However, I explained the importance of the examine MRI image and serum tumor markers for diagnosing malignancy before hypo. If the tumor is suspect of malignancy, I recommend the surgical treatment. After hypo treatment, I recommend the regular physical examination and the sonography and the MRI image check. MRI scan give us information such as tumor decreasing ratio, any other new lesion, and regrowing of the tumor margin, any other finding of potential malignancy during follow-up period. This is detected malignant case. She has menorrhagia and dysmenorrhea. Adenomyosis was suspicious by ultrasound examination. Serum tumor marker CA99 is 480. MRI image was shown about 4 cm size, slightly high signal change on cervical area with involvement of endometrial cavity. Endometrial curettage biopsy was performed. Pathology was shown mixed adenosquamous cell carcinoma. Here I get a few cases of hypo. 7 cm case of uterine fibroid. Non-perfusion area was seen inside the boundary of the tumor after hypo. 7 months later, the necrotic lesion of myoma was expulsed out of the uterus. No more myoma was observed in this figure. And this is 5 cm case 9 months later. And the volume of myoma reduction rate is 80%. And multiple case of uterine fibroid, and 15 cm huge uterine fibroid. 18 months later, the volume of myoma was reduced by 80%. And 7.5 cm case of adenomyosis. 7 months later, total uterine volume was reduced by 55%. And focal adenomyosis, and 8.5 cm of focal adenomyosis. 6 months later, the uterine volume reduction rate was 50%. This slide is a follow-up result of the post-hypo treatment. Total of 566 cases of uterine fibroid. I am targeting statistically 475 cases, except of 91 patients of follow-up loss. The uterine fibroid volume reduction rate were 55, 60, 75%, 3, 6, and 12 months. Each patient symptom severity score reduction rate is 50, 52, 50%. And uterine fibroid symptom quality of life increasing ratio was 36, 38, 40% by 3, 6, and 12 months respectively. and total of 638 adenomyosis was treated. I am targeting statistically 531 cases, except of volume loss. The result of total uterine volume reduction were 45, 48, and 56% by 3, 6, and 12 months. And each patient symptom severity score reduction rate is 60, 43, and 56% by 3, 6, and 12 months respectively. The uterine fibroid symptom and quality of life increasing ratio is 84, 76, 87% by 3, 6, and 12 months respectively. The volume of reduction rate was somewhat lower than uterine fibroid. I think that the reason why adenomyosis reduction rate is lower than myoma is the measurement of total uterine volume. This slide is complication analysis. 566 cases of uterine fibroid, symptom recover 14, new lesion of 3, secondary hypo of 2, hysterectomy of 6, myomectomy of 6, and 638 cases of adenomyosis, symptom recover 20, new lesion of 2, secondary hypo treatment of 9, hysterectomy of 9, and foot drop of 1 case, and 1 aggravated symptom of non-spondylolisthesis of 1, transient sciatic nerve pain of 18, tumor rise syndrome with prerenal failure of 1, small bowel perforation of 2. In case of a foot drop and small bowel perforation, I believe that the mistake, for example, power control or interpretation of ultrasound image were made, and the rest complications are transient and minimal severe. The pregnancy outcome was shown. The 11 patients with uterine fibroid after HIFU treatment were pregnant. 5 patients were delivered by spontaneous vaginal delivery, and 2 patients were delivered by cesarean section because of induction failure, and 3 patients ongoing pregnant. And 12 patients were adenomyosis after HIFU were pregnant. 3 patients were delivered by spontaneous vaginal delivery, and 1 patient delivered by elective cesarean section, and 3 patients ongoing pregnant. 1 patient experienced preterm labor and 24 weeks. Before HIFU treatment, I informed some possibility of being in trouble of pregnancy of my patient who weren't pregnant, because paper for pregnancy after HIFU is not enough yet. In conclusion, first, I think that HIFU treatment has very good therapeutic effect and acceptable side effect compared with the conventional surgical treatment. The second, in near future, I hope that HIFU treatment for uterine fibroid and adenomyosis will be universal treatment method. I hope that my experience and endeavor would be helpful to all of you. I know some of you may disagree with me, but I would like to share your opinion in the future. Nice meeting you. I really appreciate your attention.